The governor and federal government have deemed food workers essential, but some economists have said that we have plenty of meat in cold storage. There shouldn't be major storages at the grocery store. Will the governor support a call for any meat or food facilities to shut down if cases continue to spread, like the Smithfield plant in Sioux Falls, South Dakota? What would that threshold be? So again, these food processing facilities are critical for our food supply chain. So we need to keep them open, and so there really isn't a condition where I would call for them to be closed. Now, certainly if a company wants to take that voluntary action, that is their decision to be able to make. But what we've been approaching here in Nebraska is really working with our food processors on what are those best practices. So for example, we're reaching out to not just the food processors, but all the major employers in Grand Island about what is their plan to be able to help keep their folks healthy and safe. How are they communicating that out? What steps have they taken? I've been on the phone with the executives at JBS. Okay, I didn't call them Saturday or Sunday, but I've been in every day since a week ago Sunday. I've been in contact with them and working with them with regard to the steps they've taken, asking them to make sure they're communicating out to their teammates with regard to what are the rules, for example, around what are the things they're doing in their facilities, what are the rules around if you have to stay home, again, really focusing on people that if you're sick, stay home, and everybody in your household stay home. So we've continued to work with our food processors to be able to keep them open because it's a critical part of our food supply. Can the facilities themselves, like JBS in Grand Island or Western Reserve in Hastings, conduct more widespread testing of workers? Well, again, one of the things we know is that the testing is very limited, that JBS or whomever would want to do testing would have to probably go out into the marketplace, buy those test kits in the same way that our hospital facilities are doing that, or that we're doing it, our public health labs and so forth. I think those supplies are being generally reserved for healthcare type associations or organizations or like our public health department. So I don't know how a private company like JBS or Western Reserve would be able to get access to any of those things at this point in time. Perhaps down the road as those become more available, but I don't know how they would do it at this point.